More public? More public on anything. Since we're open, come on up. We'll just do the public sector right now. So.
Okay, great. May I just move this over this way?
Sure.
I would just like to be able to see everybody. I hate to have my back. And I can always just carry this with me, so everyone can hear me okay? Okay. Thank you, Mayor Francis, council members, citizens and residents of Hopatcong, both here tonight and watching online, for your time, attention, and consideration. You probably don't know me and are very likely wondering what I'm doing standing here in front of you tonight. My name is Kate. I have a master's in social work from Kane University. I've spent 10 years as a social worker working with primarily children and families, both here in New Jersey and in California. And for the last 7 years, once I returned to my home state of New Jersey, I've been working in healthcare with residents, medical students, medical education. I became a cannabis educator and resource for individuals, medical professionals, communities, and various organizations seeking information for marijuana-related initiatives. I recently became aware that Hopatcong has been discussing hosting a dispensary, and I wanted to come here tonight in the hopes of providing some feedback on the topic so that you can make a really well-informed decision for your citizens. Here's what I've learned over the last few years with the expansion of the medical marijuana program in New Jersey, and as the push toward recreational marijuana use, or as it's referred to in the industry as adult use. Legalization looms and people are afraid. Many towns are worried that they'll be pressured to host a dispensary, that a dispensary will increase crime, drive down property rates, and encourage use among minors. And you have a right to wonder. You have a right to wonder how this is going to impact your community, how it's going to impact the youth. The message we've been hearing for the last century is that marijuana is bad, it's dangerous, it's addictive, and honestly, that's how it became illegal. It was a social marketing campaign, and we've seen the shift in that over the years. Currently, it requires a major shift in our thinking, and I think that's scary, and I believe that's where a lot of the fear comes from, and I hear it in towns like Hopatcong all over the country, so you're certainly not alone in this. But I'm here to give you some facts about it. Cannabis has been used since the dawn of agriculture as a source of food, fiber, and fuel, and marijuana has been used since 3000 BC as medicine. Now, cannabis comes in two forms, hemp and marijuana. Hemp has traditionally been used for making sails, ropes, in war efforts and things of that nature. And marijuana, because it grows flowers with a lot of good stuff in it, has primarily been used for medicine. So now we're kind of at a point where there's a great debate about whether there's enough research, enough science, enough information to make a decision. And what I'm here to tell you is that there is plenty of science around how marijuana works for pain, for insomnia, for anxiety. We are born actually with a system of receptors in our body called the endocannabinoid system. This was born into our bodies 25 million years ago when cannabis was born to accommodate that. These receptors fit with THC and CBD molecules. We already have things that look exactly like it in our body. So when the receptors in our central nervous system and in other parts of our body are excited, it exerts activities on our body. Now, sometimes we run low on those natural molecules that we make that are shaped like THC and CBD. And so marijuana then becomes a good substitute for when we kind of need to put our glue back together. They act like natural environmental regulators. THC and CBD can regulate your blood sugar, inflammation. It's neuroprotective. There are studies that show that ingesting CBD immediately after a stroke, a traumatic brain injury, a concussion, a car accident can actually mitigate the long-term effects of those injuries on your brain. If you've seen any of the video footage of children who are having seizures or people who are having seizures and they ingest CBD and that seizure stops, I've seen that in person. I've seen many, many videos of it. But I have seen it work for many people, myself included. The FDA has approved a number of pharmaceuticals, some of which work for the same things as marijuana. But I think we've all, I can say if you have a television, you've seen the commercials, but by the time I get done with the list of side effects, I've forgotten what medication it is and what it's supposed to treat. Because we've been using marijuana, whether we've been reporting what's been happening or not, or talking about it or not, we have a ton of anecdotal evidence. We have a ton of experiential evidence. And we do have scientific evidence. We have to look at where that information is coming from, who's providing it, and what the purpose of them giving it to us, right? So marijuana remains a Schedule I drug because the federal government says that it has no currently accepted medical use and a high potential for abuse. Some examples of other substances in Schedule I are peyote, LSD, and heroin. Some examples of Schedule II drugs, which are not considered as bad by the government as marijuana, would be cocaine, meth, methadone, Dilaudid, Demerol, OxyContin, fentanyl, Dexedrine, Adderall, and Ritalin.
You're well past the 5 minutes.
Oh, yeah, okay, I can wrap it up.
No, this is important. So.
Okay, I'll be advised. Synthetic THC, which is a Schedule III substance, is legally prescribed, FDA approved, and totally sanctioned by the United States government. Now, synthetic THC is actually stronger and less tolerable than plant-based marijuana THC. The government also has a patent number 6630507 that they received in 2003 for cannabinoids as antioxidants and neuroprotectants. That includes THC and CBD. So with regard to juvenile use, I think this is really an important point, and I'll spend some time on this. With regard to the fear that having a dispensary in a town will encourage juvenile use, studies overwhelmingly conclude that as a demographic, teens in adult use states, so those states that have legalized it for recreational use, are not actually using more cannabis. There are several studies in this area published by Preventative Medicine, the Journal of the American Medical Association of Pediatrics, the Journal of Adolescent Health, and the Lancet Psychiatry. Taxing and regulating cannabis places it alongside other adult-only activities. The perception that cannabis causes less harm is actually falling among teens, and so are teen use rates. And that is likely a result of the information that we have coming out now that's informing kids about potential risks and potential benefits. Because human beings are rational consumers, we will go for something that is less harmful with fewer adverse side effects. And teens are no different. They're very intelligent, and they know that some of what they've been hearing may not be true. In terms of neighborhood crime, available data strongly suggests that licensed cannabis retailers are not associated with increase in neighborhood crime. In fact, liquor stores and tobacco retailers are far more, increased crime far more than any dispensary. In fact, most studies suggest that a dispensary in community actually lowers the crime. You have more eyes on the street, you have cameras, you have more police officers, you have security guards, and that does actually tend to drive the crime rate down. Yeah, I can,
Sure.
well, whatever, I mean, I can open it to questions,
just,
I can.
Just wrap it up. It's an important subject to us in our
Okay, this is actually the most important. This is a really important piece regarding alcohol and in places where dispensaries are located. It reduces alcohol use. In some states, as much as a 13% decrease in binge drinking in towns that have dispensaries. Binge drinking costs $250 billion. Okay, the state of New Jersey pays an average of $1.73 for every single drink that somebody takes. That's 2 out of every $5 in tax money for the consequences of drinking. Now, in those states that we know where they've put dispensaries, whether it's for medicinal use or for adult use, they have experienced a decrease in motor vehicle accidents, a decrease in injuries associated with alcohol use and other substances, they've experienced a decrease in opioid use, they've experienced a decrease in prescription drug use, and they've also experienced a decrease in binge drinking, particularly among youth. So, like I said, I wanted to present this information here tonight because there is a lot out there, and I've spent several years as a patient advocate for myself and for others. I hope that you'll take this under consideration, and again, I do appreciate your time and
Would you
attention
leave your
tonight.
contact information to us, because I have no idea where we're gonna go with this. We did have another presentation, by the way, from the Drug Alliance, Center for Prevention, and we'll continue to make informed decisions. I have my own personal decision, but I believe that the more the public knows, the more informed decisions we can make. And so, information such as you, and I'd say we had a nurse here last time that spoke along the line using that. So, if you could leave me your comments, if you could, and also your contact information, because as we move further, we'll be very open with this, and what we do when we have consideration, it'll be done at a council meeting. It won't be done in a private meeting. It's so important that I personally believe that anybody that wants to give our community information such as this, I think should do it in a public meeting such as this. I think it's that important. But for the record, if the New Jersey does legalize recreational marijuana, I have my attorney preparing an ordinance that will prohibit the sale, distribution, growth, or anything to do whatsoever with recreational marijuana. I want to be clear on that. Medical stuff is a whole other issue that we need to really get our head wrapped around. And I believe this is how we do it, by listening to people who are experts in the field and not someone who just has an opinion. But I want to be clear on recreational, crystal clear.
I certainly appreciate your position, Mayor Francis, and I, again, thank you for your time, your consideration, the council residents, and I would be happy to leave my information, my website, my cell phone number, my email,
Yeah, leave me your information, because as we
Sure.
move forward, you might get
however I can be of assistance, I'm happy to do. My mission is to advocate for wellness, so I'm happy to do that anytime I can.
Appreciate your comment.
Thank you so much, thank you.
More public?